Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today we bring back a familiar face, but you probably haven't seen him in a while. We have the co-founder and CEO of Mantra Health, Ed Gaussen. Ed, thanks for joining us.
Thank you so much. It's nice to be here.
Yeah, I'm excited to have you back. It's probably been, it must be over a year. I think we talked back in 2020, so it's maybe towards the end of 2020, but it's been a while.
Yeah, I think I still remember the pandemic was starting. It was raging, and anyways, a lot of things have happened since. So excited to update the audience.
Yeah, again, thanks so much. And just so the audience know, we're going to keep this short and sweet. If you could start off, this focus today is to announce that you just raised a 22 million Series A. But for the audience that hasn't heard of you, you give us a quick description of Mantra Health, and then I'd love to talk more about the raise and what this means for the company.
Yeah, so just 30 seconds on Mantra Health. Really started the company out of passion and deep curiosity around how to improve the status quo of mental health care for young adults. I spent several years in venture capital, which is where Matt, my co-founder, and I met each other in 2016. Had a sibling who dropped out of college because of mental health issues. Kind of saw firsthand through that experience the chaos of finding an appropriate provider, the costs related to treatment, and so many gaps in the process of getting the right support. And so, yeah, ultimately spent the majority of my time as a VC learning about this space and trying to understand what was being done to solve the multiple problems in the system. And ultimately, that sort of curiosity turned into an obsession, which ultimately led to starting the company with Matt and Dr. Ravi Shah in late 2018. And so, yeah, 3 years later, we've raised close to $28 million in total, and our program is now set to be deployed across 52 campuses, reaching 500,000 students in the spring. So it's been an amazing journey.
Super exciting. Yeah. And congrats on all the success to you and your team. I know, based on the conversations we've had, you probably still have that mindset of like, hey, we're just getting rolling. This funding will definitely allow us to take that next step. But I like dealing with the people that, even though this is a huge win, obviously for you and the company, you're just getting started. This is really just to kick things to that next level.
Really feels like it. Yeah, it's really how we've managed a company so far, and we are right now really hiring across a lot of roles. Excited to talk about that a bit more as well. But my co-founder and I really believe in at the beginning you have to be in the weeds, be nimble, and ultimately be in a place where you understand all the functions. And I think we're really at a point now where it's time to grow.
Absolutely. Now, can you talk more about the raise with us? Who led? Who else participated? And then maybe talk a little bit about, you raised 22 million. Where do you envision a lot of those use of proceeds kind of being spread out across?
Yeah. So 22 million, the round was led by VMG Partners. They are a growth equity firm with multiple billions under management. And, there was participation from other investors, New Market Venture Partners, Elements Health Ventures, 14W, Alumni Ventures, and we also had some of our existing investors come back to the table. So Canaan Partners, GFC, Valiant Capital, Western Tech, City Light Capital. So just a really exciting mixture of historic investors, new investors that are the perfect mix of, effectively digital health knowledge, ed tech knowledge, and also, deep pockets to be able to continue pushing us throughout our adventure in the years to come.
Yeah, it sounds like you have a great group of investors that you got on board. So that's always, you hear the horror stories and you have a good group around you. So it's always good to hear that. Now, in terms of with the capital, you don't have to obviously go into the bucket, but like as far as actually go into buckets, like where do you see, obviously hiring, but what areas are you hiring in? What areas do you also envision a lot of those proceeds going into?
Yeah, absolutely. So I think like many companies sort of hitting the Series A mark, we feel like we found a very special model now after spending really the last 2 years fine tuning our product with our customers, who are the universities and the colleges that we work with. And, we now need to do what's necessary to scale. So our goal is to, for example, quadruple the team size over the next 12 months across, all functions, go-to-market, product development, clinical operations, and of course, our provider group. We've already onboarding some outstanding people from, leading ed tech and digital health companies that joined us in the last 2-3 months. Other focus areas will include, clinical investments in our virtual provider group and the infrastructure there, continuing our expansion across, all 50 states, doubling down on insurance partnerships. We're launching with this round a new model that we've been piloting since last September, which is called the insurance referral model, where we're working with schools and increasingly with students' commercial and student health insurance plans. And another area for us as well, which is a little bit separate from company building, but more on the supporting the overall mission, is to continue investing in the future of mental health professionals through our diversity scholarship program to make sure that all young adults in America have the mental health support that they need within their reach. So this is something that we started last spring, and that we're really excited to continue supporting in the years to come. I think ultimately, what you'll see from us is that, Mantra will have a mental wellness pathway tailored to each student from the day they walk on campus to long after graduation.
Well, I'm super excited to continue to track the progress of Mantra Health, and hopefully we can have you on again real soon to kind of talk about what's happening, give us another update. But as always, appreciate you coming on, and wish you and the team all the best of luck.
Thank you so much, Jared.